Y'all know me, I'm Dr. B, and this is The Buzz on teething. Teething is obviously the painful eruption of primary or baby teeth through the gums. And you can just see that bottom right tooth coming in right now. Teeth typically come in a certain order. Here's a chart from 1916 that shows the usual order. And believe it or not, teeth still come in the same order as they did back in 1916. The top left shows the two bottom central incisors, and then you get the top incisors on the right, and sometimes the lateral incisors will come in there. And then what confuses a lot of people, after you get those 8 central teeth, you see the picture in the middle, you skip the canine teeth, the pointy teeth, the sharp biting teeth, the vampire teeth. You skip those and you go to the first molars. Then you come back to get those canine teeth, and then finally get your back molars for a total of 20 teeth. The first teeth come in on average around 7 months. They may come in early. I actually had a patient who was born with a real tooth, and then she didn't get another tooth until she was about 9 months old. So they can come in really at any time, but around 7 months seems to be the average. Kids may teeth for some time before a tooth is actually visible. So your child may be having some teething problems even well before 7 months. They may start teething on average, maybe about 4 or 5 months with the first tooth, like I said, come in around 7 months. Teething lasts until all the teeth are in, and those final primary teeth, like I said, are the back molars. We call those the 2-year molars, but they may take up to about 2.5 or 3 years to come in. Teething can cause a host of fun symptoms, including crankiness, drooling. The kids will usually chew on objects or on their hands. This may be some normal exploratory behavior, but very often kids who are teething will chew on your hands. If you put your finger in their mouth, they get this kind of far off glazed look in their eyes as they chew on your finger. It must feel good to them. Swollen tender gums can be a sign of teething, and sleep can very often be disrupted. Children sometimes will wake up in the middle of the night and be fussy. You have to give them some Tylenol. Tugging at the ears does not always mean an ear infection. Very often, tugging at the ears with no other symptoms can mean that they just have some teeth coming in. And the reason for that is the nerves for the teeth run up the jaw and go by the ear, and we have what's called referred pain, which means the problem is in your gums and your teeth, but the pain can be felt anywhere along the jaw. Sometimes they'll just grab on whatever is up there. The ears are sticking out, and they'll just yank on those. And sometimes looser poop can be caused by teething. However, as we'll see in the next slide, looser poop is one thing, diarrhea is something else. What problems are not caused by teething? We get a lot of people coming in saying, yeah, he's got a high fever and he's not got much energy, and I figured it was just due to teething. Well, fever is not caused by teething. You get 20 teeth in the first couple of years, and you're probably going to get several fevers, and sometimes those do overlap, and that's probably where the idea came from, that fever is caused by teething. But research does not bear that out. There is not any association between the two, other than sometimes you'll get both of them independently at the same time. Research just doesn't bear out that teething causes fever. Runny nose and cold symptoms, cough. Sometimes people wonder if that's caused by teething, but it is not. Vomiting and true diarrhea, meaning frequent, loose, large volume poops. That is not a symptom of teething. A little bit looser poop, maybe a little bit more frequent, but we should not see really running out your diaper, going up your back kind of diarrhea. So if you see any of these symptoms, we really need to look for other causes other than teething. So your kid is teething. How are we going to help them out? Well, there are non-medical or non-medicine and medical ways of helping them. As far as non-medical ways, a teething toy is probably a good idea. Everyone knows Sophie the giraffe. She kind of came out of nowhere in the 90s. And now every kid loves chewing on these when they're babies. A chilled teething ring, not frozen, but chilled, will often feel good on the gums, as well as a cold washcloth. And sometimes just feeding, especially breastfeeding, can be very comforting for the baby. So feeding the baby may also help. Let me mention for a second amber necklaces. They're very popular. These have been used for just eons. for teething. I don't know how long, so maybe someone can look that up and put it in the comments below. I'm sure it's been hundreds of years. People have been using amber for teething. But the research says that these do nothing at all. Also, these are a strangulation hazard. They go around the neck. Don't recommend that. And if, God forbid, they get broken up, a kid breaks it somehow, a choking hazard. You can get these into the baby's digestive system or get stuck in the airway. We do not want that. So I officially do not recommend using any kind of amber necklace or bracelet or anklet. Now, as far as medications, please try the non-medicine methods first. The teething ring, the cold rag, please try those first. But if no one is getting any sleep, then you can go to the medications. Tylenol is probably the only safe thing you can use here, acetaminophen. Check out episode 23 of this podcast for safe and appropriate use of acetaminophen. There are two very commonly used medicines, I call them medicines loosely, medicines that we do not recommend. The first one is homeopathic teething tablets. Some people swear by these, but there's no proven efficacy. The research says they do not work. They're basically placebo, and we just don't have any evidence that it works, so we cannot officially recommend those. The second thing that we strongly recommend against using is any kind of teething gel like Oragel, anything that has benzocaine or anything cane in it. These can be very dangerous for babies, actually. It can cause a problem called methemoglobinemia. And in methemoglobinemia, what happens is the chemical causes the baby's blood cells to not be able to deliver oxygen to tissue properly, and the child will actually turn blue and have trouble breathing. So obviously that's no good. In this photo, in photo A, the baby's looking, that's the top left, the baby's looking pretty blue, and photo C below that shows you what the baby's blood actually looks like. It's brown. It is not holding on to the oxygen right, it's not releasing oxygen right, and so it looks the wrong color. And you see how much better the baby looks after treatment in photo B, which is at the top right, and in D, even the blood looks redder. So yeah, let's not use any teething gels, please, and just stick with either the Tylenol or those non-medical methods. So now that your baby has some teeth, what do we do to keep those clean? Well, we're gonna wipe the gums with a clean cloth. If you wanna brush the gums or the new teeth with a soft toothbrush, that's great. You don't need toothpaste. It's just an abrasive for babies. So if you just use a soft toothbrush, get everything off there, it should be fine. If you decide to use a toothpaste, please use a fluoride-free toothpaste. That's if you use any toothpaste at all. And talk to your doctor about whether they think your child needs fluoride. This depends on where you live and a lot of other factors. So you're gonna have to talk to your doctor about that one. No bottles in the bed. Please don't let your baby drink anything before they go to sleep. The last thing they should do before going to sleep is have their teeth and gums and tongue cleaned, not feeding, because the milk contains lactose. That is a sugar, and bacteria love it. So we'll get something called bottle mouth or bottle rot. That is not what you want. So no bottles in the bed. And also you should talk to your doctor about when your child should see the dentist for the first time. Pediatric dentists generally say come in by the time you get your first tooth or 1 year of age, whichever one comes first. Personally, it might be a hot take, but I think if the pediatrician says that your teeth look good, the baby's teeth look good, they seem to be coming in, they look nice and white and strong, then you can wait until they're older, usually 3 years of age. Shouldn't be a problem. Well, thanks for watching today's video on teething. If you have any questions, then please comment below or reach out to your own doctor, and hopefully we'll have some good answers for you. I hope you enjoyed today's video. Please subscribe if you found anything helpful in this, and share it. Let your friends know about it so we can keep this channel growing. You all know me, I'm Dr. B. This has been The Buzz on Parenting and Pediatrics. We'll see you next time.